I'm here with Gerald Sanzari, North Bergen Housing Authority Executive Director, and Jacqui Farley, North Bergen Housing Authority Nurse and Social Services Coordinator. Jerry?
How many senior buildings in town did you test?
Well, we only did the ones that are under our control, HUD subsidized or state subsidized. This was mainly for the congregate housing, the high-rise housing where people live very close together. And so there are 5 tall senior buildings that we manage.
That includes the Lola Towers, the building they were in when we did the interview. It's a double building, so that's considered 2. And you have Cullum Tower, the largest with 16 floors and more than 400 residents, as well as Terrace Apartments on 68th Street and the Teresa Ferraro building on 62nd, which is not HUD, but according to Jerry, it is affordable housing that was built with state and county money.
Jacqui, how did you get in there and get involved in all of this in the first place on your end?
Well, the health department asked me and Jerry asked me if I can help test the seniors with Janet Castro. She was heading the testing.
We hear about the vulnerable population and the seniors being some of the hardest hit during this pandemic. Nurse Farley tells me if she had any concerns going in and being on the front lines.
I really didn't have any concerns. I was happy to do it, and they were so happy and grateful for the testing, and so happy to see, somebody familiar.
A swab, or what is it exactly?
It was a nasal swab. You just turn it like 5 times, and put it in a test tube, and send it out to the lab. And the results were back within like 1 day.
You tested so many people, any of them exhibiting symptoms or complaining of anything?
None that I saw that I tested.
Most of them were asymptomatic. We did test over 600 people in total over a period of 3 different days. 4 people came back positive. But that was a really good statistic considering congregate housing, elderly people, disabled people. We all know the nightmares that have been going on with nursing homes.
It's like a tiny number in the greater scheme of things, right?
Absolutely.
Yeah.
It's a very good number. Everybody was pleased.
So pleased, in fact, that Cullum Towers tenant Yvette Santiago sent Jerry a thank you note to express her gratitude for his unconditional support during the COVID-19 situation. It reads in part, "You're a good director, and I take pride in knowing you care about the seniors. I don't know if I will ever be able to express in words how much you have done for North Bergen Housing."
At that point, the ones that tested positive, what was the situation with them?
From what I know, 3 out of the 4 were asymptomatic. It was a surprise to them. And then, of course, they consulted with their own doctors after that and did what was necessary. One of the persons, same afternoon of the morning that we had tested, started to get symptoms and was rushed to the hospital. Sadly, that person didn't make it. He died.
Really?
Yeah, a few days later.
Oh, so sorry to hear that. Jacqui, what was the treatment for the remaining tenants, the ones that tested positive, and where are they now?
They self-quarantined themselves.
Okay.
For the 2 weeks. Also call whoever they've been around, notify, their children if they've been coming over to see them, so that they can also be aware that they can spread it or test themselves.
And what I've been told, those 3 have all recovered already since we did the testing. The health department was tasked with informing the positive cases. Those 4, our staff notified all the people that were negative. It was a joint effort with the Hudson Regional Hospital, I think it's called, in Seahawk. They provided the test kits, and the health department and my staff did the testing.
How meaningful was it for you? We hear all of these stories of people really doing the right thing and trying to help in any way they can. And here you were, being able to really get in there and organize this.
Why we didn't do it sooner, was cost. Some of these tests, they run like $60 each. You can imagine if you're testing 1,000 people. The hospital must have received some kind of federal funds through the CARE Act, I'm guessing, or from the county. And it was passed along, and then it was feasible. I came up with the idea. It was perfect timing. We were able to do it without a cost to anybody.
Jacqui, where do you go from here? You lost 1, self-quarantined 3. Not over yet, right? They say they're
not over yet. No.
Right. People are getting a little complacent and not wearing their masks. Oh, the governor is opening everything up. We don't have to do this anymore.
I see them, or, I see someone or I speak with somebody, I remind them that they still need to wear their masks, wear their gloves, stay 6 feet apart, because it's not over. You don't know what's coming.
This pandemic was first announced in early March. Immediately started working on a infectious disease plan an
Okay.
action plan and policy for the housing authority. As time went on, I expanded on that policy. It started out with like 14 bullets, and now it's up to over 20. This is actually the policy here. It's 3 pages long. And there's all kinds of actions that we're taking, rules for the tenants, rules for guests.
They're now at the point of testing everyone who comes in the building with a temperature gun in order to stop the spread of the coronavirus. So they have since ordered the no-touch thermometers you see at the airport in an effort to identify who could be sick among those with early onset symptoms.
They're actually arriving this week, and they'll be installed at each building's lobby. A person walks through, will tell the security guard that they're either, healthy, or if they're running a fever. I think it's 100.3 or above is considered a fever. Then we would not allow that person access if they don't live in the building. Of course, if they live in the building, we would just tell them to self-quarantine, or ask them to self-quarantine, and for them to notify their doctor. Also had a few employees that had come down with COVID-19. One of our office staff and a maintenance person. One office worker is back to work now. He had a rough time. He was out over a month. He had a pretty bad case, pneumonia. When it peaked in April, we had a couple more cases of maintenance people. And we have an office staff person now who's out with COVID.
How are people picking this up? Because a lot of times you talk to people and they say, I had no idea how I got it.
We tested all of our employees as well. Give them the antibody test. I actually paid for that out of federal funds that we're allowed to use for that. Only a few had the antibodies, which means you had it at one point, but and those people didn't even know when they had it or why they had it.
They had no symptoms.
And then most people just tested negative, meaning they just didn't have it, but they didn't have antibodies. The testing is only good for the day you take it. You could come down with COVID-19 the next day. So, I anticipate there'll be more testing. Right now, it seems like the state of New Jersey and New York is on a downslide. Could be that the virus is not as virulent because of the hot weather. Don't know, right? They don't know that much about it. I'm really concerned because people are becoming lax, things are opening up, but I also see the other side of it. People are suffering, small business owners are suffering. We got to get back to normal. I guess it's a balancing act. I trust that our governor knows what he's doing, and we'll see what happens. I mean, I'm very concerned that there could be a resurgence in the fall. I think a lot of people are. But we're going to be prepared. Still ordering masks and gloves and sanitation products. We're still enforcing our policy. Nothing is going to change. Until the governor lifts the pandemic emergency completely.
Just taking it moment by moment. And as you said, Jacqui, still doing all the things that we need to do and precautions because there's really no other way.
Yeah.
Exactly. Yeah.
With this policy that I had put together, I actually got a call from the regional director for New York, Connecticut, New Jersey, Puerto Rico. He liked the policy so much, he asked me if he could use it as like a prototype or model policy for any housing authority that inquires.
Really?
Under his umbrella. And I said,
wow.
Absolutely. I like to think we were ahead of the curve. We kind of like, predicted that it was going to be bad, and we took a lot of steps to keep our people, our residents and staff healthy. It's been hard for a lot of the tenants, senior citizens especially. They need to socialize, quarantining in the house and not being able to do all the things they love to do.
Right.
And we haven't been able to have these social gatherings and the seminars that we're famous for.
Very isolating.
It's sad. I mean, the anniversary parties had to be canceled or postponed. Hoping that, by the fall, we'll be able to get back into having our seminars and our gatherings. Because depression is a real thing too. And a lot of people who suffer from depression or melancholy, they're experiencing it now more than ever. Our staff would go out and shop for some essentials for them.
Oh, that's nice.
We tried our best, and we've had to explain it to them. In the beginning of this, a lot of the elderly tenants didn't understand. I mean, some of them were trying to come up to me and hug me, and because I'm a personal guy, and that's always was the way in the past, but we couldn't do that anymore. So, it was a little bit of a learning to explain, that this is serious.
So it was hard for us to not be able to hug somebody or kiss them.
I'm doing job sharing, 1 week work at home, 1 week come in. I've been trying to make it as fair as possible. The bottom line is we couldn't close. We can't stop working because our funds depend on us leasing out these apartments to the people that need them. That's why I believe we were included in that list of essential workers.
Hopefully the seniors will come out of it feeling a little better as the days go forward. We're lucky to have you guys there, supporting them.
I'm lucky to have the staff that I have and to have the tenants I have, because they've all been wonderful. Everybody has risen to this challenge. I would love to take credit for all of it, but I can't. It's everybody. It's a team effort. And the township has been so supportive. The mayor, the commissioners, the health department. Janet Castro's been terrific. The police department's been terrific. I can't say enough good things. And thank you to Jacqui, because she's been great. I think what the township is getting ready to test all the residents in North Bergen, to at least offer tests. Tremendous.
Clean the bags.
Every 2 hours, we're cleaning all the touchable surfaces. And
you mean within the buildings where the
within the building, and them with their groceries and everything. They were, we would tell them, just clean everything before, you eat it or anything like that.
And we were lucky. We were able to get all the supplies we need. Our vendors are all long-term contracts, so our vendors were very good to us.
I mean, it's good to know, at least, in the back of everyone's mind, where can I help? It's a matter of really, doing something close to home.
I love to give to charity. I do that. My father taught me that. But I always feel like you should take care of your own community first.
Yeah, I'm so happy that we got to connect and hear what you guys have been up to.
It's meeting you.
So thank you.
Yeah.
Thanks, Jillian.
All right.
I'll talk to you.
Take care.
Bye.
Bye.
Okay,
Bye.
bye.
Bye-bye.